Hi, I'm Matthew Diabes, a PhD candidate in organizational behavior and theory at the Tepper School of Business at Carnegie Mellon, and I'm excited to present this work to you that's been generously funded by the Tepper Healthcare Initiative. In this research, I'm looking at the impact of dispositional well-being, or a person's psychological and social health factors, on their development of trust on short-lived teams, which we call flash collaborations. We're looking at this in a sample of patient transporters in a hospital setting. I've conducted this work in conjunction with my advisors, Professor Taya Cohen and Professor Laurie Weingart, as well as Dr. Jeremy Kahn, who is a physician and medical researcher at the University of Pittsburgh Medical Center. Before I get started talking about this research more specifically, I'd like to introduce you to the more general setting of collaboration in healthcare. In emergency healthcare settings, teams are constantly in flux. Membership changes from patient to patient and from task to task, and especially since the COVID-19 pandemic, there's been a high degree of turnover. And so in contrast to what things might look like on a traditional team, for example, where the same three individuals might be working together as they move from task to task over time, collaboration in healthcare looks more like this, where the focal person here in green is working with a completely novel set of individuals as they move from task to task over time. And so in dynamic settings like this, in which who we're working with is constantly in flux, it becomes more crucial to understand individuals' consistent attitudes, behaviors, and performance across their teams, across unpredictable configurations of other collaborators over time. And so to give you a little overview of the theoretical background of this project, I'll talk a little bit more of the prior research that has inspired it. So well-being is generally defined as a person's feelings of happiness and fulfillment in life. And it has a profound impact on the generalized interpersonal behaviors and experiences of a person. High levels of well-being are associated with having more trust in others and perceiving others as more benevolent and kind. As a result, individuals with higher levels of well-being tend to be more communicative, benevolent, and kind and helpful to others. In contrast, individuals with lower levels of well-being tend to be more distrusting of others and perceive others as more malevolent and have more social anxiety. As a result, they tend to be more prone to withdraw socially and perform more interpersonally destructive behaviors like ostracism. As a result, we predict that greater well-being will be associated with more trust development on these short-lived teams, which will lead to more effective collaboration. Specifically in this context, we look at collaboration in terms of how effectively they share the workload on their teams. To test our hypotheses, we looked at a sample of transporters at 5 hospitals in a large multi-site healthcare services provider. Transporters are ad hoc teams that are tasked with transporting patients safely between units within the hospital system. So for example, if a patient is done in radiology, a team of transporters will be called to move them from radiology back to the patient's room. Importantly, for our research design, transporters are actually randomly assembled to tasks by software. And so who they're working with, as well as who they have to collaborate with at the points of pickup and drop off of the patient, are pretty random. Patient transporters have to coordinate not only with each other, but also providers within the points of pickup and drop off within the units. And so the job of transporting patients throughout the hospital is a very collaborative one. To give you a quick overview of our design, we ran a multi-phase experience sampling survey. In the first 4 weeks of the project, we ran an individual characteristics survey in which we measured several individual characteristics as well as the well-being of transporters. In addition, we measured baseline job attitudes like job satisfaction and satisfaction with their coworkers to rule these out as alternative explanations for any observed phenomena. And we also collected demographic data at this time. In the following 4 weeks, we conducted our experience sampling surveys. 3 times per shift for a total of 4 weeks, transporters were surveyed on phones that they use for their job, on how things went on those particular trips when they were surveyed. They were asked to respond about the trust they had for the people they worked with on those trips and the effectiveness of the workload sharing on that trip. In addition, we asked them to report their familiarity with other team members on the trip, as well as how difficult the trip was. To give you a very quick overview of the results, using multi-level analyses, we did find a cross-level effect that individuals' dispositional well-being, so the dispositional well-being of transporters, was predictive of the trust that they developed trip after trip after trip, team after team after team over time. And this increased trust was associated with greater workload sharing. Further, we found that dispositional well-being was predictive of the level of effective workload sharing on their trips because of trust. So we identified trust as a key mediator of this process. So in sum, we hope to answer the question with this research: how does an individual's feelings about themselves and their life impact how effectively they work with others across teams and tasks? We hope this provides a path to predict how well people will collaborate in dynamic teamwork environments where aspects about the team are very difficult to know in advance. Finally, more practically, we hope this underscores the importance of investment in employee lifetime well-being, things like employees' mental health and quality of life, not only for the individual employees, but also for their teams and for the benefit of their organizations. Thank you so much, and thank you again to the Tepper Healthcare Initiative for making this research possible.